Thank you all so much for being with us today so we can update you on our continued response on our fight against COVID. I'm here with Commissioner of Health, Dr. Lance Fry, and OESC Executive Director, Shelley Zumwalt. Thanks for being here today. Oklahomans have come together in an incredible way over the past 30 days to slow the spread of COVID-19. Also, across the state, more people than ever are following our 3 W's. They're washing their hands, they're watching their distance, they're wearing a masks. You know, I want to thank Oklahomans for choosing to make personal sacrifices to protect their loved ones and neighbors from COVID-19. My 3 goals have been the same since March, and that was to protect the health and lives of Oklahomans, number 1. Number 2 is to keep our businesses open safely. And number 3, to keep our kids in school safely. Over the last few weeks, the 7-day average of new cases has been relatively stable. We have it up on the screen there. We're actually at 3,058 cases on a 7-day average today, and we were at 3,002 about 2.5 weeks ago on November 23rd. Over the last 4-day average, we've had a 2,200 cases per day. But let me be clear, these cases and these numbers are still too high. However, the data shows what Oklahomans are doing is making an impact. Today is 2 weeks after Thanksgiving, and I am cautiously optimistic that we've started to flatten the curve and our trends are moving in the right direction. Earlier this week, I met with doctors and nurses from hospitals in the Oklahoma City and the Tulsa areas. We had a no-holds-barred conversation with leading doctors and nurses and ICU nurses from right here in the Central region. I did a lot of listening. I want to thank them for coming in and speaking with me. And I heard stories about ICU nurses that are FaceTiming with families before they intubate a patient. When that happens, they're usually in that situation for a week or 2 weeks, and it's just heartbreaking. And I'm telling you, our nurses, our doctors, they're exhausted. They have been fighting this since March. They need our help more than ever right now. They've added capacity. They're working extra shifts, and the overall theme, they're tired. Our healthcare workers are heroes in this fight against this virus. Their stories are real, and they need our help. If you don't think COVID-19 can affect you or your loved ones, I'm here to tell you it can affect anybody at any time. So now is the time for us to do more in our fight against COVID-19. A vaccine is on its way, but it's not here yet. So I'm asking Oklahomans to join me together for another push so we can get to the light at the end of the tunnel. So let's talk about how we get there. I'll be issuing an executive order with a few things to step up our fight and bring our cases down. Attendance at youth indoor sporting events will be limited to 4 spectators per participant, or 50% of the building's capacity, whichever is lower. Public gatherings are limited to 50% capacity unless the local health department has granted an exception. Examples of public gatherings include weddings, funerals, holiday parties at event centers. This doesn't apply to churches, but I want them to continue to innovate. You know, most of the churches that I've talked to are checking temperatures before the kids go into nursery. Their workers are wearing masks. I encourage them to continue to innovate, continue to do that, continue to offer online options every other row, just like all of our businesses are doing at this point. We need all Oklahomans stepping up the effort to help our healthcare workers in this critical time. We're also extending the rules for bars and restaurants. We're requesting that tables are 6 feet apart. We're also going to continue to make sure they're closed at 11 p.m. except for drive-through or takeout. We'll also keep requiring masks for state employees at work and for visiting state buildings. The CDC has identified restaurants, bars, and sporting events as areas where we need to be more careful. What makes them great is also what makes them a little more risky. They take us out of our bubble and bring people together who aren't normally together. That increases the potential for the virus to spread, and that's why we're taking these additional steps today. I know this is a challenge, and these actions will personally affect many Oklahomans. These are difficult and complex decisions, and I want every Oklahoman to know that I don't take any of these decisions lightly. Please don't forget your local restaurants or bars who need our support more now than ever before during this holiday season. Just like it's critical to slow the spread of this virus, it's also critically important to support our local businesses, keep our businesses open safely. I've heard from many Oklahomans who want me to issue a statewide mask mandate. I've also heard from many, many more Oklahomans who don't want me to. The goal is to get people to wear a mask. You know, it was a month ago today that Dr. Julie Watson and doctors from across the region joined me to ask Oklahomans for their help on this. So here's the data from Carnegie Mellon University. Based on this data, Oklahoma has gone from 79% of Oklahomans wearing masks on November 1st to more than 87% of Oklahomans today. We've closed the gap with Alabama and Louisiana, and they've had mandates in place since this summer. You know, it's not about magic words. It's about Oklahomans doing their part to slow the spread of this virus. And I'm pleased to report COVID-19 vaccinations are on their way to Oklahoma next week. We expect 166,000 doses to hit the state of Oklahoma in the next 3 weeks. That will let us make great progress for our healthcare workers, our highest risk groups, and prioritize their vaccination. It's not the end of our challenges, but the end is coming. That's my message for Oklahoma. We can see the light at the end of the tunnel. We are going to get through this together. The reality of this situation is that it's up to every one of us to keep Oklahomans safe, keep our neighbors safe, and slow the spread so we can keep our kids in school, we can keep our businesses open safely. So please keep watching your distance, wear a mask when you're around others, wash your hands frequently. Now I'll turn it over to Dr. Fry for an update and some changes on our quarantine policy. Dr. Fry?
Thank you, Governor Stitt. As you all know, our COVID numbers had been increasing in our state prior to Thanksgiving. That led us to appeal directly to Oklahomans to do more to protect themselves and their loved ones during the holidays. You heard the governor say this, I'm going to use the same words. I remain cautiously optimistic, but I'm happy to report the numbers have remained relatively stable since Thanksgiving. It looks like most Oklahomans did their part, and I want to thank you. Keep it up. The vaccine is coming soon, but we have to remain vigilant. We ask you to get tested, and we performed more tests in our state than ever before, and our capacity remains strong for continued testing in the state. I want to encourage you to continue testing. If you think you've been exposed or are traveling for the holidays, please get tested. Research shows us that the 3 W's, particularly wearing a mask, can help prevent the spread of COVID-19 in Oklahoma. I'm extremely proud of our public health and healthcare workers on the front lines and how much of themselves they have given to this response. In public health, we're all about protecting health and preventing disease. However, like Governor Stitt said, we need to do more to reduce the cases and provide some relief for our hospitals and healthcare workers. I talk to our healthcare professionals every day. I know that they're on the front lines and they're exhausted. They're working day and night to give care to our sickest Oklahomans. That is why we're announcing additional steps today. We all must continue to do our part to slow the spread of COVID-19. In addition to today's executive order, I'd like to provide some guidance on actions Oklahomans can take to slow the spread of the virus as we go into the holiday season. As you celebrate, consider gathering virtually or with members of your own household. If you do gather with others, keep gathering small and ensure you have enough space to socially distance with 6 feet between each person. Gather outside if the weather permits. We recommend you wear a mask anytime you're around people who aren't members of your own household, and always wash your hands frequently. We can still all celebrate the holiday season in a safe and responsible way. I know it's hard to make these adjustments. I'm struggling along with you. Everyone is. But I can't overstate how important it is that we don't let our guard down now. I also want to ensure all Oklahomans are aware of the important changes that the CDC guidelines on quarantine. The new guidelines provide options to shorten quarantine. They still recommend 14-day quarantine if possible, but they give other options. One is to shorten it to 10 days or 7 days in certain circumstances. You can quarantine can end after 10 days without testing if no symptoms have been reported. You can test out after day 7 if you test and get a negative test and you don't have any symptoms, you can test out on day 7. We know that it can be difficult for many people to quarantine for 2 full weeks, particularly if employment or childcare issues won't allow for it. These new guidelines are intended to allow flexibility while keeping us safe and healthy. I want to stress that it's important to observe the quarantine period according to the guidelines to ensure the health and safety of your family and loved ones. We're very optimistic with the expected arrival next week of the vaccine in Oklahoma. But it's important to note that the vaccine is just part of slowing the spread. Your actions are making a difference. Every time you choose to follow the 3 W's, you're protecting those around you and yourself. You might even be saving a life. We're adding an extra W for 2021. Wear your mask, wash your hands, watch your distance, and wait for the vaccine. Don't let your guard down now. I'm going to turn it over to Director Zumwalt at this time.
Thank you. I've got short and sweet for you guys, but I'm very excited about this announcement. In my position as Executive Director at OESC, I made a point of being transparent and accessible to claimants and to the press. At times, that has required me to personally deliver difficult information to citizens and claimants. But I feel strongly that leadership is not about a title, but being called to run towards the challenge or the fire instead of running away, and showing up every day when it's hard. And I see a lot of examples of that type of leadership in this room. While we wait to hear about a federal relief package, Oklahoma is taking decisive action to help our citizens who've experienced unemployment this year. I can't tell you how excited I am to have good news today. This year has been tough on so many, and to have good news that will impact so many of our claimants after they've had such a tough year. OESC has received guidance that allows us to distribute the remainder of the federal FEMA Lost Wage Assistance Funds, and the agency will be making one-time $400 payments to over 120,000 Oklahomans. The LWA program was the multi-week $300 payments that went out to eligible claimants August 1st through September 5th, earlier this year. The eligibility for this one-time payment is the same as the LWA program was. You must receive at least $100 in any benefit type, have been impacted by COVID, and the only change is the eligibility week. It's going to be the week following the original last week of LWA. More specifically, it's September 6th through 12th. The agency will begin distributing these payments the evening of Wednesday, December 16th, next week, with the first payments arriving in claimants' accounts Thursday morning, December 17th. We will continue dispersing these one-time payments through Monday, December 21st. It's important to note these funds can't be used for any other program. They're restricted, and their guidelines are determined by our federal partners. These are also not state funds, and they cannot be distributed into the UI Trust Fund. I hope this announcement is a bright spot in a year that has brought so many challenges to the people OESC serves. And I feel so very fortunate to be able to deliver good news to you today. Thank you.
Thank you so much. That's great news, Director. That's great. Thank you, Dr. Fry. To recap our three goals. Number one is our first priority has always been to protect the health and lives of Oklahomans. Number two is to keep our businesses open safely. And number three is to keep our kids in school safely. With those goals in mind, to recap, here's what we're doing. We're following the new CDC guidelines. I think that's a big win for Oklahomans, for working parents. At 7 days, you can test out. Limiting attendance at youth indoor sporting events to 4 spectators per participant or 50% capacity in the building. Limiting public gatherings up to 50% of capacity. Extending the changes for restaurants and bars. Continuing to require masks in state buildings. And getting additional money to Oklahomans who are still struggling to find a job. So I want to thank Oklahomans again for working together to slow this spread. I know this isn't easy, but we are going to get through this. We're all cautiously optimistic where the trend lines are, and getting the vaccinations in Oklahoma, 166,000 by the end of this month, is really going to be a game changer. So let me open it up for a few questions.
I have a question for Dr. Fry. My question is on your vaccination phased-in approach. If someone is 65 years old and under but has underlying conditions, is there any way those individuals can be moved up on this list?
So if they're 65 but do not have underlying conditions?
Know that they do have.
Oh, they do have underlying conditions. We had an independent board put together those guidelines for us. And interesting enough, they did that quite some time. We were one of the first states to get our plan in, so we did quite some time before a lot of the national guidelines came out, and they align with those guidelines. So I think they did an extremely good job. That's something that we still look at every day and consider. And I also want everybody to know that those groups, they don't have walls around them. Some of those will be done at the same time. And Deputy Commissioner Keith Reed's here if we need more information. But there are times where we're going to be doing some groups, some in one group and another simultaneously. So we're going to get shot. We get 1,000 doses. We're going to use all those doses. And if we don't have 1,000 frontline healthcare workers, we're going to give it to other people around. I mean, it's fluid. It's not necessarily as structured as it looks in diagrams. It's just we're trying to get that information out so people kind of know what to expect, but it's going to be very fluid.
Question for Governor Stitt.
Like that.
Governor, how long will these orders be in place?
So all of our executive orders last for 30 days, and then we'll reevaluate them as we're watching the numbers. And we're in constant contact, daily contact with our healthcare professionals across the state. Dr. Fry briefs me every single day. We talk every single day. So we'll watch really closely, and we want to lift those as soon as possible. But really, it's about hospital capacity right now. And with the hospitals really being exhausted and at a point where they're getting at capacity. And so that's why I'm asking Oklahomans. That's why we're putting these make sense.
Those beverages or eat that food in my establishment, as long as I don't sell any further after the deal? Or was it your intention that those places shut their doors and have their patrons exit by 11:01?
I think it was that at 11 p.m. is when the alcohol would stop, and then they would start shutting their doors, yes.
So just to be clear, people can stay in the establishment after 11 p.m. So long as they're not purchasing anything new. Is that correct?
I think we're splitting hairs there on staying in. I don't think I expect anybody to shove somebody out the door at 11:01, and I'm really not worried about. Oklahomans always do the right thing, and so just hoping Oklahomans will do the right thing. And I haven't specifically asked the ABLE Commission what they're doing at 11:01, but we can get back with you on that.
Okay, because I think that there have been some news reports and evidence of establishments being cited for having sold their final food or beverage at 10:55, and then people still being in the establishment at 11:15 and then getting a $100 ticket or something like that. You're saying that was not your intention?
Yeah, I'd need to check on that. I don't know if you said they're getting fined at 10:55?
No, they're getting fined after 11 p.m., even though they're saying they're reading it to say that it's only sold after 11 p.m.
Okay, gotcha. We'll go back and try to clarify that.
Thank you.
I also have a question for Colonel Fry. So last week, I think we asked you about the discrepancy in the number of COVID deaths between the CDC and what the State Department of Health is reporting today. The State Department of Health is reporting 1988, and the CDC is saying 2,503. So now it's over 500. I don't know if you have an update to that as to why those are so different.
You know, I don't. We were going to get you an update, and I'm sorry, I actually didn't do that. I don't know if somebody from my team was able to look into that or not. Okay, we'll definitely get you one this week. I'm sorry about that.
The State Department of Health and the Governor's Office has access to where ICU bed availability is, but it's not shared with hospitals and healthcare workers. Is there a reason why that's not happening?
We developed a system now where they are able to see that, and we have our transportation system where, to help with transfers, that has ability to visualize where bed availability and ICU beds are. And so that's working well at the time. Initially, we had a system that the EM resources system where they were putting in all that information. That was information that was given to us by the hospital, so they have to put it in themselves. And we always would have no issue sharing that, but those individual hospital systems at that time didn't want us sharing that information. So now things have evolved since then. They're all working together. They've got their own regional systems they're doing that with, and we've got our RMRS system that's helping them. So things are much different than they were when we started.
I have a question for Governor Stitt. Do you anticipate that you and your family will take the vaccination?
Well, as far as I'm concerned, I'm not going to jump in front of any health professional or long-term care professional. So we'll wait in our turn in line. And then as far as I've already had the antibody, so I'm not sure exactly what the doctors say, but always recommend that people listen to their doctors and believe in the vaccination. So when it becomes my turn, I'm sure I'll take it.
Commissioner Fry, I have a question for you. It's been a little more than 2 weeks since the governor issued his last executive order limiting bars and restaurants and curfews. I was just wondering if you could quantify at all what impact that you all might have seen on the number of cases, number of hospitalizations.
Sure. I think you can. I don't have a timeline with all those numbers on there, but I can just tell you in general, our numbers were going up initially. They were going up at quite an alarming rate for everyone. Those have plateaued, and again, I use the words cautiously optimistic, but we seem to be around the same level for the last several weeks. So I think that it really has helped. That and the messaging that we did with everyone to do the right thing over the holidays. It seems to be working, and we're very happy. We hope to bring it down more, and I hope that these new actions will. But I'm glad that it at least seems to have stabilized.
This is a question from Ben Felder at the Frontier. We wanted to see how many vaccine doses the state expects to receive in the next few weeks. The number cited seemed to be a little different from the Department of Health number, and we just want to see if there was an increase in that.
Commissioner Reed. So there has been some changes, so he has the details on that, and we're getting some initial doses followed by repeat doses coming in, and Keith has the details.
Yes, sir. I'm Keith Reed, Deputy Commissioner, State Department of Health, and the governor is correct. What we're tracking right now is based on the information from Operation Warp Speed and the CDC, is that we'll receive just over 166,000 doses by the end of the month. A couple of those shipments are scheduled for the very end of the month, like December 30th. And then there is one other shipment that we're tracking that we don't have quantities on, so it actually could exceed that amount. But that is based off the current information we have. We are looking at 166,000 plus doses by the end of the month.
When you say doses, do you mean doses for individuals, or some of those take 2 doses?
So the way we are doing that, when I talk about 166,000 doses, that would represent the first dose for 166,000 individuals in Oklahoma. The remaining doses will come on subsequent shipment to provide them their second booster dose.
I have a question for the governor. There's been several weeks now with recommendations in the White House report that we're not implementing here. One recommendation this week has gone on that for several weeks is reducing capacity in centers to 25%, restaurants and bars, and other public event spaces. Is there a reason why you chose 50 instead of 25%? Because 50% in a gym would still be hundreds of people.
Yeah, so we're trying to balance, and I can let Dr. Fry give his reasoning for that as well. But we're trying to balance listening to all the recommendations coming from the White House. We have recommendations coming from all over. You can watch what other states are doing. We think this is a make sense, separating 50%. The idea is only sitting with your family every other row. We think 50% capacity makes sense in indoor facilities.
A question from Paul.
That's a great explanation. We looked at, do we do a certain number? Do we do percentage? Do we do distancing? The venues vary so much in size that it's hard to be too granular with it. So we went with the percentage just to make people space out and decrease the numbers.
Will this include gyms or retail stores?
We have not done, I don't think those were considered public gatherings, so we'll look at the language of the EO, but I don't think those were in there.
Question from Janelle Steckline. She wanted to know, when does the new capacity orders take effect?
The executive order is being drafted now. It'll probably hit, the executive order will be released either later today or tomorrow. We usually give it a couple days to take effect, so probably no later than Monday.
Are there any plans here to extend the 11 p.m. curfew? It should be expiring in a week.
Yeah, that was one of the things that we're going to extend the 30-day, for another 30 days, the executive order that talked about the 11 p.m. Bars and restaurants.
Governor, do you have a message to some of the bar restaurant owners who say, this is unfairly pointing them out as far as the reason for the COVID spread and they're losing money and revenue? Do you have a message for some of the restaurant and bar industry?
Yeah, so we looked at all of the data. We had the analytics. We had the health professionals tell us what do we need to do to make sure we keep our capacity down. And the two things that they told us would move the needle the most in Oklahoma was bar and restaurant capacity, really after 11 p.m. And so that's why we did it. Our heart, my whole goal is to keep businesses open safely. To do that, we have to have our hospital capacities to be able to take care of our most vulnerable and our sick. So it is always a balancing act. We also provided over $19 million to bars and restaurants earlier on in the pandemic from the CARES relief funding. And so if we get another stimulus package, that's also going to be one of the first things that we do. But again, we're trying to balance all these things. And We really have to protect the capacity, and so we're just asking Oklahomans to continue this fight for a little bit longer, and we can really see the light at the end of the tunnel. The 166,000 doses, nobody anticipated that Oklahoma was going to have 166,000 doses by the end of this year. So that's something that we're cautiously optimistic with our curve flattening. We can get the doses in here. We already have about close to 190,000 Oklahomans have recovered. Our antibody testing is showing that we've got 22-something% of Oklahomans have already had the antibodies for COVID, may not even ever got tested. So we're starting to see some of those numbers, and so we're cautiously optimistic that we're starting to see these numbers come down as we see this go through the population.
Governor, you just mentioned a couple pieces of data. Would it be possible, or Charlie, would it be possible to get some data on that antibody testing you just mentioned, 20%? And specifically, you said a couple times that experts provided data on bars and restaurants being the hotspot it would be most targeted. Could we get that data? I think there are business people out there who question, is that real? Did that come from somewhere? And I think if we could get that, we might be able to do that.
Sure, we have that. We'll get you that data.
Thanks, everybody.
Thank you.